Welcome to Global Healthcast, brought to you by Global Health Press. Once a week, we cover for you news on infectious diseases, vaccines, and vaccination. Today is Tuesday, April 5th, 2023. I am Joe Schmitt, and as always, with me is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt, and good afternoon and good evening to those of you who are watching in different parts of the world.
This is our 32nd Global Healthcast edition, and today we still focus on COVID-19. Here are our topics. Melvin will give you the COVID-19 update. He will tell you about the roadmap for COVID-19 vaccination in the Omicron era. We will cover long COVID and factors that may result in long COVID. I will talk a little bit about SARS boosters who should get vaccinated. I will report on no increased risk for cardiovascular events after boosters. And finally, we look a little bit into antibodies and protection after COVID vaccination. Melvin, what is the news on COVID? Where are we in the pandemic?
Yes, so for those who have been watching us for the past 31 episodes, you know the drill, right? So we start with a global COVID epi update, and we get this from the WHO COVID situation report. And you can also check this out if you want. This is something that they put out every Wednesday or Thursday. And this is a week late because they're all, of course, they're looking at the data first and compiling them, and then that's when they can do the report, right? So just to bear in mind that this is not real time. But again, if you look at this figure, you will see that nearly 3.6 million cases have been reported the past week and over 25,000 deaths. So this is actually a decrease from the figures the previous week, right? And despite this downward trend in terms of cases and deaths, there were actually countries who reported increase in cases the past week. And if you look at the next slide.
Melvin, before we go to the next slide, what is interesting here is high number of deaths, quite low number of cases initially. And now the deaths are down and the numbers are roughly what they were here in 2021. So what happened here?
That's right. And this is something that a lot of people have been asking and talking about in social media as well, right? But I think there are several things. Firstly, I think now a lot of people have immunity to the virus, right? And many people have been vaccinated, many people have been infected, and many people have hybrid immunity, right? So this is the immunity you get when you have both vaccination and infection. And of course, the younger and healthier people, they are less likely to have comorbidities as well, right? And so their immune systems are working well, are functional. And the other thing that's to be considered as well, I think, is the fact that many people now have robust immune memories, particularly the T cells. And I think we will discuss this again in the succeeding slides here today, right? Antibodies and T cells. And also maybe the virus has changed. So the virus from Wuhan as compared to the different variants and the current Omicron variants, it's also changed a bit. And as a community, we've also improved in terms of how to manage the disease, right? So all these different factors, I think, can answer that question.
So all in all, we did something right. That is the short story. Now, I'm sorry.
We've learned.
I apologize for holding you up. You have more data on disease and deaths.
Yeah, so at the country level, the highest numbers of new cases were reported from the US again. Although there has been a decrease in cases in the US, but they're still one of the top five. Russia reported an increase in cases actually. The Republic of Korea and China is still in top five, even though they reported a decrease. Japan as well is in the top 5, even though they've reported a decrease as compared to the previous 28 days.
And where are we with deaths?
Well, with deaths, it's always interesting because when I mention top 5 in terms of the number of cases, it's not always all of them that are part of the top 5 in terms of the number of deaths, right? So US is still there, Japan is also there, China is also there, but in terms of deaths, two countries that are not in the top 5 in terms of cases, but are in the top 5 in terms of deaths are the United Kingdom and Germany.
Oh, really?
Yes, Germany is there in this current report.
Okay, that is total numbers, not percent of those infected. This is total numbers, right?
Yes, that's
Okay.
right.
Okay. Now you have another interesting slide here.
So the gray figures, right, the ones that go up and down, and you will see them as the number of cases, right? And
Right.
the yellow is the number of deaths, which you asked earlier. Why is it that the number of cases are similar in terms of the figures, but the deaths are going down? That's the yellow. Number of new hospitalized cases is the blue, and the number of new admissions to the ICU is purple.
So this is the full data set depending on disease severity from cases, symptomatic cases probably mostly, and up to death.
Yes.
Very nice.
And this is interesting, Bryce, because it started from really 2020, and it shows you the evolution of the virus or our medical management as a community and immunity and all these things that we've mentioned in the previous slide, right? It gives us an idea, of that.
Yeah, very nice. Boosters. We talk a little bit about boosters today. It is spring now, April 5, and everybody is asking, should we get an additional COVID-19 booster dose, or is this no longer necessary? I'll cover a little bit of that, but you have recommendations from WHO. Maybe you can summarize that from us.
Yeah, so this is a long document from a long meeting within the WHO strategic advisory group, right, for vaccination. And here I will just cover the 4 main topics that were discussed. And firstly, here you will see that the WHO will be recommending additional boosters. So this is beyond the initial booster and the 2 first doses, right, or the primary vaccination. They are recommending this for high risk people only. And also, the chair of the WHO committee said that the very high risk groups might really benefit from even more frequent boosters. And I think this is in line with the data from Qatar. And Qatar is an interesting country because they have really good data in terms of vaccination and disease severity. This is what they are recommending, that for people who are at high risk, an additional booster would really benefit them. Even
Sorry,
though, sorry,
Melvin, you're stuck. Melvin?
oh, I'm stuck.
Yeah, now you're back. Can maybe you start again with this slide for the first time? Boosters, where I said, can you explain the slide, and maybe you start all over again from here.
Yeah. So the WHO will be recommending additional boosters beyond the initial booster dose. So this is beyond the 2 primary vaccination doses and the initial booster. And this is what they're recommending for high risk groups only. And this is also in line with the data that we've seen from Qatar. And Qatar is an interesting country because they have very good data in terms of vaccination and disease severity.
Melvin, you're stuck. I'm sorry. Melvin,
How about now?
now it's good. Maybe you continue with Qatar.
Okay.
Or maybe should we dial in again and start all over? Or I'm not sure. We are with slide 7 of 21. Maybe we start all over again, but maybe it doesn't get better. I'm not quite sure. What do you think?
Yeah, I'm not sure if it will get better.
Yeah. Then let's try. Let's. Or maybe you start again with the boosters for all. Explain the slide. I'm sorry for that.
Yeah.
Okay.
Okay. So now we will be talking about the roadmap for COVID-19 vaccination in the Omicron era. And this is a document that's been released by the WHO. And this was from a meeting of the WHO SAGE. So they will be recommending additional boosters for high-risk people only. And this is also in line with the data from Qatar. It's an interesting country because they have good data in terms of vaccination and really disease and disease severity. And they have seen in Qatar that for those people who are high risk, so the elderly with comorbidities, if they are given additional boosters, it really helps them, keeps them out of hospitals.
Okay.
Yep.
So boosters for all are no longer needed, but those who are at high risk, they should get boosters.
Yes.
And now the next point then seems to be important. You may even need more than one dose a year.
Mm-hmm. So they also recognize that the need for booster may be more frequent in the highest risk groups. So this includes the immune compromised, because we have known from the very beginning that even after 2 doses of, let's say, the mRNA vaccines, people who are really immunocompromised might not be as protected, right? So they are recommending that the highest risk groups may need more boosters actually, as compared to just the high risk groups.
Interesting. Yeah. Okay. We keep an eye on that one, what that means. I've had 5 doses so far. So that means I should get 2 more doses this year based on my age, but we'll cover that again later. What's the next recommendation?
So this is for pregnancy, right? They are recommending boosting during pregnancy if the last dose was given more than 6 months earlier. And this will be, I think, covered in your next few slides as well. Why 6 months? What is the reason for that? And I think this is actually smart because boosting really protects mothers during a risky time, and especially if the booster is given in the third trimester, the infant will even be born with some COVID-19 antibodies, right? So I think that's a good recommendation.
Yeah. And what is the pediatric summary then?
So this is the part that I am not very sure whether this is actually helpful, because for children, they are recommending to consider the primary series and booster dose for healthier children and adolescents only within country contexts, including disease burden in the age group, cost effectiveness, and other health program priorities. So I think they're trying to push the responsibility back to the countries depending on what is happening there. In a way, this is, I guess, okay, because they're not really forcing the countries to vaccinate healthy children and adolescents, right? But I think some children, even though the healthy ones, also need to be vaccinated, given the booster.
Hmm. Well, this is a separate issue we should discuss in one of our next global health casts. Pediatric vaccination is much debated in Germany and in other countries because the benefit for children is relatively small. But in any event, there is severe disease in children, not only the multisystem inflammatory disease, but other events as well. So let's discuss this, and we just recognize boosters for all are no longer needed. High-risk group may need more than one booster dose a year. Pregnant women should get the vaccine. And then for pediatrics, we go for the country context and you follow local recommendations. I guess that's the summary from the WHO SAGE meeting, right?
That's right. That's right.
Very good. You have another topic on COVID and actually on post-COVID.
Yes, this is a publication that came out of JAMA Network Open, and it really talks about the prevalence and characteristics of post-COVID conditions, or the PCC, or long COVID, in adolescents and young adults. And the researchers here concluded that the findings question the usefulness of the definition of the WHO for post-COVID condition, because they've seen that there may be other factors that really influence or would predict the person's future in terms of getting PCC or long COVID or not. And it's not just the infection of SARS-CoV-2 itself. They have seen in this paper that two psychosocial factors stood out in terms of risk for PCC, and this is low physical activity and loneliness. And I think the low physical activity can be explained, of course, right? Because for people who are healthier or more fit or who have been exercising, the risk is, of course, not zero, right? But then it's reduced. Loneliness, I think this has something to do with the person's mental health, right?
Very interesting. So this PCC really is an interesting disease, and COVID is maybe just something like a trigger or an enabler or a booster for something that pre-exists one way or another. It's a very interesting concept that you come up with here. Yeah.
Yep.
Very nice. Now, we had been discussing who should get a booster dose and who is at high risk for severe outcomes, hospitalization and death from COVID. And in the United Kingdom, they did a study based on the fact that they have an excellent database on public health, and they did a prospective cohort study. The cohort was constructed, I guess, in a computer, and they looked at adjusted rate ratios for the association between risk factors for COVID and for COVID hospitalization and death. Then they identified in the end 16 million people who had completed primary vaccine schedule and 13 million people who had received booster doses. And then they looked at the risk for severe COVID that was reduced after booster, and certainly the booster reduced the risk. Now, what were risk factors for severe disease? And this is from a very large graph, and I just did some copy paste out of here to get some interesting findings. So time since vaccination is not necessarily a predictor for severe disease, for hospitalization and death, but age is. And that starts roughly here at 69 years. You can see here for the mRNA of Moderna and for the BioNTech Pfizer mRNA. And as of 70 years, you see the risk increases. And certainly if you're above 80, you have a relatively high risk. If you have underlying diseases, and I'll show you some of that in a minute, the more you have, the higher the risk. And finally, if you had SARS-CoV-2 infection at least 9 months ago, you are protected. The dot moves a little bit to the left. You can see this here, and you can see this here. So very interesting. In a little bit more detail, what are the underlying factors, risk factors for severe COVID and death? And that is solid organ transplant, renal transplant, bone marrow, immunosuppression, rare neurological diseases, sickle cell disease, chronic kidney disease. If you have chronic kidney disease, there is a high likelihood that you lose your antibodies through the urine because your kidney doesn't absorb them, or actually they leave the urine through a damaged kidney. Blood or bone marrow cancer, cirrhosis of the liver, actually they also have a problem with immune responses, right? Chronic kidney disease, stage 4, pulmonary hypertension, chemotherapy, and then there are some others with a comparatively low risk. But this is the main risk factors, and feel free to read the paper. Nice data, nicely summarized here. And you can see if you are at high risk for severe COVID hospitalization and death, and if you should get one or more booster doses following the WHO recommendations that Melvin was presenting. Melvin, any questions on this one before we go to the next?
I think it's just additional data that supports recommendations, right, to get boosters, especially for the high risk and the immunocompromised. And it really makes sense.
I have another study or another piece of information, and the background for that one is that the vaccine safety data link of the Centers for Disease Control and Prevention in the United States alerted the public about a possible increased risk of ischemic stroke within 21 days after the bivalent COVID-19 vaccine had been administered in persons 65 years of age or older. Now, here in France, they did a study that was population-based. They used comprehensive data from the French National Health Data System, and they were able to link this to their COVID-19 vaccination database. They looked at people 50 years of age and older, and they had looked at those who had received a booster dose in a special time frame where the bivalent and the monovalent vaccines were both used not concomitantly, but at the same time in France. And again, in this time window, they did the study with the respective population. And in the end, as the results, they found 472,000 vaccine recipients and 97,000 who had received the monovalent vaccines. And again, 373,000 had received the bivalent vaccine. So this is basically the database. And you can see at 21 days follow-up after the monovalent or the bivalent vaccine, this is the hazard ratio. And what you see here, there is no increased risk. The hazard ratio is crossing 1. So this is a non-significant finding. But if anything, it is a reduced risk, right? If you look at all these numbers, it's lower than 1. But again, it's not significant as the 1 is crossed between the two ends of the 95% confidence interval. So there's no increased risk for ischemic stroke, hemorrhagic stroke, myocardial infarction, pulmonary embolisms, or all 4 items combined together. Very good news. And just as a reminder that adverse event doesn't mean side effect. And the public health authorities in the United States did the right thing. They reported a signal. There may be something and you should know about it. But in the end, you have to verify if there is really a correlation between vaccination and the signal. Melvin, any insights from your point?
I think this is really good to reassure people of really that there's a safety of these vaccines, right? But again, it really boils down to how these data are being understood by the public, right? And how they're being presented. And I think people should look at Global Health Cast 9 and check out our discussion about these things.
Yeah, very good. And I have one last item I would like to cover, as I always like to speak about efficacy and immunity. Protection and immunity. This is a very nice study, and we repeatedly told you that there is a difference in vaccine efficacy when the endpoint is asymptomatic infection, symptomatic infection, hospitalization, or death. And what you see here nicely is from a systematic review that all available vaccines are only 50% efficacious when it comes to reduce asymptomatic infection. Efficacy is approaching 80% when it comes to preventing symptomatic infection. They have a much higher efficacy when it comes to severe COVID, which is hospitalization, severe infection, ICU admission, whatever, and death. So this is the message we have been telling you all the time. But in addition to that, they not only looked at vaccine efficacy, they also looked into correlations between antibodies and protection. And that you see here. You see here on the y-axis, this is vaccine efficacy. And on the x-axis, you see the log-transformed antibody concentration. So over here is high antibody concentration, here is low antibody concentration. And in general, there is a correlation. You can see nicely here, this is the curve showing the more you go to higher antibodies, the more likely you are protected. But this is neutralizing antibodies. And on the left side, you see symptomatic infection. And here you see severe disease, as I outlined before. And you can see this curve is a little bit shifted to the left side here, a little bit here to this higher end, and it also concentrates over here. So this nicely tells you again, there is some indication that antibodies protect. There is a significant finding here for antibodies to protect. But at the same time, look at this, very high antibodies, but vaccine efficacy is only, let's say, 50%. And look at here, there is very little efficacy, but very high antibodies. What I want to point out is, again and again, immunity is not equal to protection. And it doesn't make any sense at all to go to a routine laboratory and measure your antibodies to find out if you are protected against COVID. It makes no sense at all. If you got the vaccine, you are very likely protected. It is not 100%. This is the data that I showed you, right? You are protected with 50% against asymptomatic, 70, 80% against symptomatic, and even higher for more severe disease. Actually, efficacy wanes with time. This is also nicely shown. But again, antibodies do not necessarily predict 100% or do not really well predict that you are protected. That's the point I wanted to make, and I'm very happy I found this publication, again, to make the point that we made earlier on here in our Global Healthcast. Melvin, any insights from your side?
I think we've been saying this for the past Global Healthcasts, that antibodies are good, and it tells you something. It tells you that you've been infected or you have been vaccinated, but it does not tell the whole picture. And yeah, it's reassuring that this is actually out there.
Yeah, actually, antibodies are available as a therapy. They have been licensed against some variants. They have been licensed as a therapeutic agent. And you may remember that Donald Trump was one of the first to get that type of antibodies even before they were licensed, right? But in the end, the antibodies are only an indicator that you had the disease or that you had been vaccinated. But the height or the amount of antibodies is no necessary predictor of vaccine efficacy. The authors have this not only with neutralizing antibodies, they looked at different types of test methods, and you always find the same correlation, but it is never a strict correlation that would predict that an individual with a certain antibody titers does or does not have protection against COVID-19. Any last insights from your side, Melvin, before we go to the final slide?
Well, I think it also shows us that until now, we still don't have a correlate of protection for this vaccine.
Yeah, and it will not be in the near future because there are all types of tests out there. Each company has their own licensing tests. So it's a very difficult situation. And stay tuned on the topic. I guess we cover more. We covered the COVID-19 update. We spoke about the roadmap for COVID-19 vaccination by WHO recommendations. We may need repeated boosters if you have risk factors and if you're in the older population, if you're pregnant. Child policies are out there as for country recommendations. We looked into long COVID, and there may be social factors that trigger post-COVID condition. I covered whom to give SARS-CoV-2 boosters. We looked at increased risk, that there is no increased risk for cardiovascular events after the bivalent COVID vaccine. There had been this warning from the Centers of Disease Control. And finally, we looked into COVID-19 vaccines, different efficacies for different outcomes, and antibodies and protection, immunity and protection. Melvin, you have a very last slide.
Yes, this is a these are photos I took over the weekend in Paris, and so there is sakura. There are cherry blossoms in Paris. For those of you who have no time or resources to go to Japan, you can go to Paris. There are lots of cherry blossoms there, and I think it's really a beautiful flower, right, for me, because it has a lot of symbolism. It's the end of winter, the beginning of spring, and it's just also reminding us of the beauty of life, because it's just 2 or 3 weeks that they're there and they're gone. And yeah, I really love cherry blossoms.
Thank you very much, Melvin. I have not seen any cherry blossoms here in the middle of Germany, in close to Frankfurt. But in any event, please write us which topics you would want to be discussed next week. You can download the PDFs of our presentations from the link below. Please like, share, or leave your comments in our chat. Thanks for listening. I am Joe Schmitt, and with me was
Melvin Sanicas. Thank you, everyone. Stay safe. COVID is still there, but it's getting better.